Hey colleagues, how do you decide when to think about medication, either increasing it or introducing it? That's a question I've been asked a few times recently in teaching sessions with GP trainees. Let's make a comparison to this. If I'm making a smoothie, sometimes I find it won't blend, and there could be different reasons for that. For example, I might not have put enough liquid, maybe I forgot to plug it in, or it could be the blade needs sharpening, or maybe there's some kind of a problem with this base unit. In that moment, I don't know why the smoothie is not blending, and there's a number of different variables that I could try altering. Usually I would start with the most common things which are easiest to modify. So for example, putting some more liquid in, checking that the plug is turned on. I would only move later on to things like addressing the electrics inside the base unit are going to have a lot more potential for things to go wrong. So that's how I would think about something like medication. It has a role, and we don't know at first glance what role or how important that's going to be. It makes sense to start with things which are easy to change and which have less risk of other harms or problems coming from them, and then to step up if we haven't found enough of a solution with those initial approaches. It doesn't make sense to ignore factors like sharpening the blade or checking the electrics, but we're going to do those aware of any potential harms that could come. So they're probably not going to be the first thing that we start with. So that's how I would address solving this problem of my smoothie potentially not blending, and it's how I would approach a mental health consult. Give it a try and see what you think. If you're interested in mental health consults in primary care that go as smoothly as drinking a smoothie, then follow What Do I Say Next for effective, everyday, easier mental health consultations.